Now for the top story tonight, reaction. Joining us from Boston, Dr. Johnathan Gruber, who teaches economics at MIT and helped shape the Romneycare program in Massachusetts and advised on Obamacare as well. So, Doctor, would you support a one-year delay?
No, I would not, Bill.
And the reason that you want to go forward with this system that's kind of chaotic is?
Because we're overreacting to short-term news. Look, when we set up a system in Massachusetts, which really piloted what we're doing nationally, the first month we had 123 people sign up. We had to delay for months because of the same kind of issues we're facing nationally. But by the end of the year, we had 40,000 people. The law was widely supported by residents of our state. It just takes a while. We can't overreact to day-to-day and week-to-week noise. We have to look at the long-run trend and see how it's going.
Okay, but it isn't fair, is it, to find somebody who can't sign up, even if they want to sign up, because that's the situation we have now?
Look, we have to ask ourselves, is this law making things better, worse, or the same? For the vast majority of Americans, as you mentioned, 90% of Americans have group insurance who have private insurance. This law doesn't affect them. It's affecting the minority of people with individual insurance and the uninsured. Well, it will affect them, though, Doctor. It will affect them if their premiums go up, if their employers, say, look, this is how much we're going to take out of your check. And then we don't know that yet because we just don't know what the final Obamacare mandates against the companies are going to be. But let me get back to Massachusetts because that's in play. That's in play. All right. So Massachusetts now, the wait for to see a doctor, an internal medicine physician, has increased from 33 days before Romneycare to 50 days now. Why? Okay, let me go back. First of all, in group insurance, we do know what's going to happen because we've seen it in Massachusetts, which is absolutely nothing.
You can't extrapolate that on a legislative level. Let's stay with the facts.
Okay,
and these are the facts.
You just want to extrapolate something on Massachusetts level. I want to extrapolate something on Massachusetts level. Let's play in the same level playing field. In Massachusetts, employer-sponsored insurance premiums went up at exactly the national rate. This law will not raise employer insurance premiums. It will not lower them in the short term.
Okay, but President Obama said it would lower them. But let's look. Let's get it very clear. 33 days before Romneycare, 50 days now. Why the increase in wait?
That fact is incorrect. If you look at the surveys that were done of doctors, on average, doctor waiting times, which were very high in Massachusetts before our law, did not go up.
Okay.
They went up for some specialties, down for others.
I'm just, here it is. This is from, and this just came out, the Massachusetts Medical Society, July 2013. All right, its 9th annual Patients Access to Care study. That is where I just cited you. You say that's bull, that's bogus, the study doesn't mean anything, it's wrong.
What I say is, if you look at that same study and you look across specialties, some specialties went up, some specialties went down.
This is internal medicine physician, family care physician.
Internal medicine physicians, they didn't measure in that survey.
All right.
Right, 33 to 50 is not from before the law. They didn't measure that before the law.
Okay, it's from 2007 to 2013. All right, is that fair? 33 to 50.
They didn't.
33 to 50. Why is the wait period going up?
If you look at that survey, overall across all doctors, it went up for some and down for some, but did not go up on average.
Okay, that's not what this study says, but we'll move ahead. According to the Boston Herald, in 2013, healthcare will consume 41% of Massachusetts' budget, as opposed to 23% in 2000. Enormous rise in costs for the citizens of the base state. You say?
I say that basically, if you look across the nation, it's pretty comparable. Basically, healthcare costs have been going up at 7 to 10% a year
and I agree.
For a long time.
But that's not what we're being sold, that this Obamacare government intrusion, whether it's on the state or federal, are going to bring premiums down for everybody and control the spending. In Massachusetts, it hasn't, and the wait time, even though you dispute it, I'm going to have to go with this, is almost doubled. So I'm not seeing why you're so confident. If Massachusetts is running this way, why the federal system, which is going to be much more difficult to impose? Final. You believe, as many believe. Go ahead. Go ahead.
What I'm saying is, you're picking certain facts. You're not saying other facts.
But the big ones. I'm giving you the big ones.
Overall
cost and wait time.
No, you're missing the wait time. No, the biggest one is 2/3 of the uninsured citizens in Massachusetts got health care coverage. Premiums in our individual market came down 50%. We have a 66% public approval. Those are facts, too, that you're not choosing to present.
All right, because I'm zeroing in on the problems of execution. All right? Now,
Okay.
you must know that the Bay State is a huge debt. Now, when you say more people are covered, that's true, but it's an income redistribution play. It's taking from those who have and supporting those who have not. And that's what this is all about, isn't it not?
This is about, there is no doubt there's large income redistribution in this law bill, and you can like it or not, and that's a debate for another day.
Okay.
But that's not fundamentally what this law is about. Fundamentally, this law is about providing financial security to Americans who today can be bankrupted at a moment's notice by having a bad gene or getting in a bad traffic accident.
I am with you on pre-existing conditions, and I am with you on providing health insurance for those who can't provide it for themselves. I am not with you on the state and the feds doing it. I think it can be done in the private sector and by select laws. I want to continue this conversation with you, Doctor, because you're a very smart guy, and we appreciate you coming on the program tonight.
My pleasure being here.